So today we're going to talk about tummy tucks. So standard tummy tuck, or what people like to, what we call is abdominoplasty, is the technical term. So what's involved in a tummy tuck? What kind of recovery do you get from a tummy tuck? What's the surgery look like? So, you know, what I'd like to discuss here is who's the typical person that would come and get a tummy tuck. If you've had some, you know, maybe you've lost some weight and you just have a lot of loose skin around the upper part of your belly as well as the lower part of your belly. Maybe you've had some children where your muscles have splayed out of the way, which is very common. It's called diastasis. Maybe you've had, you know, maybe you've had sort of a full tummy, and now you want, you know, the extra skin and the part that's sort of hanging over, which we call a pannus. You want that removed. All of that is accomplished with a tummy tuck. So what does the incision look like? The incision goes from your hip to hip. Sometimes it can extend a little bit past that, depending on where the fold is and how much loose skin there is. If the skin is wide and it goes past your hips, the incision is going to go past your hips. But we leave it in such a way where it stays within the bikini line and it's well hidden, and a well-designed scar is going to heal almost scarless, especially if there's minimal tension on the scar. So what is actually involved in doing a tummy tuck? So when we do tummy tucks, we do it to remove the skin, sometimes remove some of the fat. We're able to do liposuction in your hips as well as your flanks. So we contour. This is body contouring, okay? So if you have a lot of loose skin, maybe fullness, so what happens is we make an incision and we dissect up under the fat on top of the stomach muscles, all the way up to, believe it or not, where your ribs are. So once we do that, then the skin has a lot of looseness, and the fat comes with it. So what happens at that point is there's layers of fat in your tummy. So there's a deep layer, there's a middle layer, and then there's the skin. So what I like to do is I like to remove all the fat in the deep layer, and I don't remove the fat in the upper layer because that's very necessary for blood supply so that you don't have any healing issues. And then once that happens, we contour it. A lot of times if we have diastasis where the muscles have splayed, and most moms will understand that when you do a sit-up, you get this sort of bulge down the middle of your tummy. That means that your muscles have splayed. If that is the case, what we do is we do something called application. And what we do is we take the edges of those muscles, and if they're here, now we bring them closer. What that does is it sucks your waist in, and it gives you that nice hourglass appearance instead of that sort of flat, sort of, you know, maybe like beer belly sort of look to your stomach. That takes it away. Then what we do is we stretch all of the skin from your belly button all the way down to where your pubic bone is, and we close it together. Now, because we've done the surgery, we've thinned the fat, all the way up to your ribs, the skin has a lot more laxicity, so we're able to pull it down. We remove all of the skin from the belly button all the way down. Now, the belly button stalk, your belly button is tethered down to the middle part of your abdomen. So what we do is we actually cut around the skin at the top of the umbilicus, and that separates the umbilicus stalk from the skin. So now we're able to slide the skin over the umbilicus stalk, suture it down to where the pubic area is in your groin and your bikini line, and then we make a little hole and we just pull your umbilicus through the top, and now you have a new looking belly button. You have a nice tight, nice flat belly that has more contours. If we've done liposuction on your hips or your flanks, now you have that nice hourglass appearance. It's a great surgery. It gives women a lot more confidence. You don't have this pannus that you're tucking into your pants, and there's no more loose skin, no more bulging. Nice and flat, nice and tight. It's a great surgery.